So welcome and thank you for joining us today for our virtual Atlantic Radon workshop. It is a partnership between the Lung Association of Nova Scotia and NSPEI and the New Brunswick Lung Association. And we have partnered to facilitate this event with the generous and ongoing support of Health Canada. We would also like to thank Fantech, who is supporting this event as well. For both of our lung associations, breathing is at the core of everything that we do. And with radon being the second leading cause of lung cancer and leading cause of lung cancer in non-smokers, we are committed to raising awareness and taking action to protect Atlantic Canadians from the dangers radon gas poses. My name is Lacey Sutherland. I am the operations coordinator at the Lung Association. I've been with the Lung Association since 2021. And since then, I have taken on our radon file. So let's get cracking. Oh. All right. So before we begin, I did want to do a brief land acknowledgement. I'd like to recognize that we in Halifax are located in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people, the past, the present, and future caretakers of this land. We are all treaty people. And I would also like to recognize that you are joining us today from many different places and acknowledge the traditional owners and caretakers of those lands. Please join me in a quick moment of reflection to acknowledge the harms and mistakes of the past and consider how we are and can each in our own way try to move forward in the spirit of reconciliation and collaboration. So briefly, the Lung Association, we are a charitable health organization dedicated to improving the quality of life by preventing and managing lung disease through advocacy, patient services, education, and research. Part of that is radon gas. Briefly, for anyone who is not familiar with radon gas, it is an odorless, colorless, tasteless gas caused by the breakdown of uranium in the soil, rock, and water. Radon can enter the home and building anywhere that connects to the ground, where air pressure in the home is lower than the ground. But Melanie Langell will get into that more in depth later on, I believe. And in enclosed spaces, it can build up, leading to high levels, which can be harmful to the health over extended periods of time, so your lifetime exposure. And radon can enter a home regardless of it's new or old, so it's important to test regardless. A couple of health risks. It is the second leading cause of lung cancer in Canada, and 1 in 5 lung cancer cases in North American non-smokers is due to radon exposure. And then when radon decays, it releases alpha particles, which are radioactive, and those particles can get lodged in the lungs and damage the cells and DNA over time. So a couple of things that the Lung Association of Nova Scotia and PEI has done to increase awareness and some initiatives on this are Radon Detector Library Loan Program, which has been a fantastic partnership that was launched in Nova Scotia in 2017. And then the PEI Lung Association at the time launched it in 2019. So that has been a fantastic and ongoing partnership. We have the mandatory radon real estate education course for realtors. That is ongoing, and it was launched, I believe, in 2018. The daycare radon testing pilot project, which was launched in 2020. We have provide long-term radon tests for lung cancer patients in Nova Scotia for a research initiative with Dr. Wallace, who will be speaking later on today. We have an MLA Radon Detector Loan Program, which is a spinoff of the Library Loan Program, and I'll get that into a little more detail later. And then we're hoping to launch a Atlantic Radon Working Group as well. So we're excited to talk about that more today. I'm just going to briefly go into a little bit more detail on a couple of our projects that I have personally been involved in since joining in 2021. So our daycare radon testing pilot project. Yeah, so why we created this project. Nova Scotia is known to have high levels of radon across the province. There's definitely some known hot pockets for radon. Joseph will be going into that more in depth later on. We know long-term exposure to high levels of radon has negative health impacts, and children are definitely very vulnerable to high levels of radon exposure as well. And we know that radon is a concern in the province. There's already been some fantastic action being taken to test and remediate provincial schools and buildings. And then there's concern around, children child care centers. There's a lot of them. I believe in 2020, there was an estimated 28,000 Nova Scotian kids ages 0 to 5 in childcare, and they do spend significant hours in daycare as well. So we recognized there was a need for more radon awareness in this industry. So we launched this in 2022 in October. It was during the second COVID-19 lockdown, so that did pose some challenges, and we had to shift the way that we execute this project a little bit. But essentially, we wanted to offer free long-term radon test kits to daycares across Nova Scotia to test their centers for radon. We initially started with outreach to over 300 daycare centers across the province. We were only able to successfully reach about 100 of those centers. We used email, phone, and letter communication. There's various reasons, the amount of time that these ECEs and the owners operators have to chat on the phone. We might have gotten an ECE on the phone, but they wouldn't have decision-making authority. Some answered to board of directors, et cetera, et cetera. It also in COVID-19 times, minimum staff as well. So those were all reasons. Of the 300 we did outreach to, we reached out to 200 successfully. Of those, 46 agreed to participate. Unfortunately, only 17 centers went on to complete testing, and all those centers were within Health Canada guidelines of under 200 becquerels per meter cubed. Because of this low data rate, we decided we needed more, so we launched 3 surveys, which we promoted heavily using paid social media, and we used priced incentives as well. And these were really to increase our understanding of what there is for radon awareness and perceptions currently for Nova Scotia childcare centers. So to do this, we had one for owner operators who actually completed the testing, understand their experiences with it. What did their radon awareness increase from participating in this program? What are their thoughts around radon testing in childcare centers? One for owners, operators, and staff who didn't complete radon testing. We want to know, had they already completed it? Like I mentioned, because of the low efficacy, some of that actually included, there was lots of privately owned daycares who were already in provincial buildings, such as schools or other provincial buildings. So we knew they already had tested for radon and would have been mitigated if it was required. So that was something that we learned from this as well. But we wanted to know their own perceptions. What was their current radon awareness? Were they aware of the health risks? What did they think about radon testing in their centers for the future? What did they know about radon testing? So helped us kind of make a guide for future initiatives. And then one for parents as well. They're sending their kids to these daycare centers, and they spend lots of their time in there. So we wanted to know what was their radon perception anyways, as well it helps to increase their awareness for their own homes as well. So we launched these 3 surveys. They went from September 1st to October 31st in 2021. And then after that, we ended up doing interviews with daycare owner operators, really to get a more in-depth conversation around radon in childcare centers. We interviewed owner operators who had actually completed the testing through our initiative, and then as well as those who did not. Really, we were able to have some really great in-depth discussions around radon and radon awareness. What's the most effective communication methods with daycare owner operators and their staff? We found that was email, just due to the time that they have, so that they can answer and respond to us in their own time, and that way it continues to have a thread as well. We wanted to understand barriers to radon testing and mitigation because we had such low uptake in the free radon tests that we offered. A lot of it was lack of awareness, concerns about cost of mitigation. There's also barriers around if they were renting the space, what were the rules around that, needing permission, as well as board directors, they would need permission from that. So those were all barriers that we learned and discussed about. We wanted to talk about how to encourage and normalize radon testing for future initiatives, what they saw as the role for radon testing mitigation, and what they thought the role of the government was for radon testing and mitigation. And so we took all of this information from our testing initiative to our surveys, to our interviews, and then we hosted a government stakeholder meeting in February 2022 to discuss the results and hopefully future opportunities to continue work to increase radon awareness in this industry. Really, this project highlighted the need for further initiatives. There was a lack of awareness around the dangers of radon gas, what it is, and then the ease of testing as well. So there's definitely future opportunities. But it's important to provide like that education in a very tactful way so that we don't scare parents with the fact that radon is the second leading cause of lung cancer, but it is and important to be aware of as well. But currently this is on pause as the Nova Scotia childcare industry is undergoing significant change. So it's just not a feasible time to continue advocacy initiatives, but we do plan to continue this at a later date. The next one that I've been involved in is the MLA Radon Detector Loan Program. So this is a spinoff of the Library Loan Program. It was launched in November 2021 during Radon Action Month. It was really great timing because we had just had an election in August of 2021. So we knew that the MLAs would be in their offices for 4 years, so we would have a stability across the program. So in year one, we had 26 spots for MLAs to join this program, and they filled up completely, so that was fantastic. And then in the second year of this project, in May 2022, we expanded the program to the remaining 29 MLAs in the province. There is 55 total, and we currently have 30 MLA constituency offices participating in this program across the province, which has been great. If an MLA had agreed to sign up, we would provide them a short-term digital radon detector kit for each office, similar to the library loan program. So they get a digital radon detector, lots of radon education materials, how to easily use, the detector, what to do around long-term testing, where to find long-term tests, the importance of using a CNRPP individual for radon mitigation. And there was significant demand as well in several of the offices. So we were able to add a couple of extra detectors in those offices to reduce the wait list as well, which has been great. We were finding that typically the demand is in more urban locations around the HRM. My suspicion is because of just population density. And then ways people are learning about this program. Social media is a great one. E-newsletters via the MLA's constituency office communications has been incredibly popular way for people to learn about it, which was really interesting to learn throughout this. Walk-in traffic to the offices, especially when they were offering COVID-19 rapid tests. So that really drummed up some foot traffic, and then word of mouth, particularly in small towns as well. And so to support the promotion of this program, the Lung Association, we have our own webpage that highlights all of the different participating MLA offices. We do frequent social media communication, and we help curate content to make it easy for the offices to promote this program as well. So it's been really great success. We're really grateful for this partnership as well to increase awareness across the program. And then lastly, we are hoping to launch in partnership with New Brunswick Lung Association and Atlantic Radon Working Group to really bring together stakeholders from across the region to stay informed on current radon initiatives within the region, We're hoping to do something around a quarterly basis to really check in, see what's happening through the region, learning from one another's opportunities, their successes and challenges, looking for ways that we can collectively use our voice in the region on when it makes sense, supporting the Radon Action Guides, which were just released by Health Canada, which I believe Shuni Cassie will get into a little bit more later on, and just stay current with what's happening in radon initiatives. And I believe that is it for me, everyone. I appreciate your patience as we navigate this new platform. And I'm happy to answer anything in this time that we have left. So thank you so much. I do want to recognize our supporter for this event, Fantech, as well. So please pop any questions in the chat if you have any, happy to answer them. And if not, so, oh, Doug, go ahead, pop your question in the chat. You're allowed to talk. Go.
Hello.
Hi, how are you?
Good, thanks. Sorry, Douglas House. I'm a manager of environmental public health in Newfoundland and Labrador. I don't think I can use chat for some reason, but anyway, I'll ask my question.
Great.
So with respect to your MLA loaner program,
Yep.
You're offering a short-term radon detector.
Yep.
I'm just wondering about the pros and cons of doing that, because of course with a short-term detector, you're getting a snapshot versus the long-term data collection. So someone might see a low result and say, oh, everything's fine.
Yeah.
So what does your education material say with that, about that?
Yeah, so it encourages we do have lots of disclaimers in that it's only a screening tool. The purpose of this program is to increase awareness, increase access to education tools, and to start conversations between MLAs and their constituents and us as well around radon, right? Including in those education materials, we do have we took the Health Canada library loan booklet and tweaked it. So it's including information on where to access long-term testing, the importance of long-term testing, where to place it, including mitigation. So your 200 becquerels for your to 600 for under within 2 years, and then above for 1 year as well. But yeah, we highlight that as a screening tool, and long-term testing should be done regardless, but it's really more so to get those conversations started between us MLAs and their constituents.
Okay, thanks.
Okay. Anyone else? No, I think we're good. Okay, so the way that Zoom event works, we're all gonna go back to the lobby. And then you will be able to join our second session of the day with Melanie Langell. So I will be ending this shortly. It'll kick you guys all out into the lobby, and then please join session number 2 of the day with Melanie Langell. Thank you so much, and I will see you guys there.